Hi everyone, my name is Beverly Quintana and I work in the communications department here at the Association of Asian Pacific Community Health Organizations, or AAPCHO for short. As you know, AAPCHO is a national association of 34 community health organizations dedicated to promoting advocacy, collaboration, and leadership that improves the health status and access of Asian Americans, Native Hawaiians, and other Pacific Islanders. Before we get started, please take a few seconds to respond to the poll on your screen so we can get a better understanding of who our audience is today. Take a couple more seconds. Thank you for chiming in. Okay. Close the poll now. So here are the results. Which of the statements below most closely describes your organization? It looks like a handful of you are part of your organization's voter engagement team. So this is really helpful for the rest of the presentation. Thank you. So on behalf of AAPCHO, again, I wanted to thank you for joining us for today's webinar entitled Best Practices for Voter Registration at Community Health Centers. We're excited to present you with today's webinar on how voter engagement programs can be integrated into a health center's day-to-day operations. Joining us today as your presenters are Jeff Caballero, Executive Director of AAPCHO, and Mark Weatherhorn, Project Director of Community Health Vote. Before we get started, I want to review a few housekeeping items and let you know how you can participate in today's webinar. Here we are looking at an example of the GoToWebinar attendee interface, which is made up of two parts. The viewer window, shown here on the right, but maybe on the left of your screen, depending on your browser or computer operating system, allows you to see everything the presenter will share on their screen. The control panel, shown here on the left, but maybe on the right on your screen, allows you to participate in the webinar. Please note that all attendees are in listen-only mode and will be muted during the presentations. By clicking the orange arrow button, you can hide or show your control panel. You can also set the control panel to auto-hide or not to auto-hide by going to the View menu. After the presentation, we will be holding a Q&A session. To participate, you can click on the blue raised hand button shown here on your control panel. Alternatively, you may also submit questions in writing during the presentation by typing them in the questions field. We'll be reviewing them as they come in and we'll address them during the Q&A. Today's webinar is being recorded and you will receive an email with a link to view a recording of today's presentation after the webinar. With that, I'll hand it over to our first speaker, Jeffrey Caballero.
Thank you very much, Beverly. Good afternoon and good morning to some of you out in the Pacific. Wanted to thank you for participating in this webinar, which is an AAPCHO members only webinar on voter registration and civic engagement. If you are on this webinar, let me emphasize, you have been selected by your organization to develop or coordinate your health center's voter registration program. If you are not that person, I want you to know that you're being considered to be that person. And if you are still did not know that, then you are a person who are still trying to decide who in your organization is best for this position. This webinar is being conducted because AAPCHO leadership has made a commitment to enhancing civic engagement among our member community organizations and the communities that it serves. In addition, you are on this webinar because your health center and your health center's leadership is also making a similar commitment. This effort is not being conducted in a vacuum. National policymakers, as many of you know, and the role of state and local policies are even more critical than ever. The Foundation, a partner of AAPCHO for the last 2 years, is launching a national civic engagement campaign. This campaign started about 2 weeks ago when 120 CEOs of community organizations that serve Asian Americans and Pacific Islanders throughout our country gathered in Florida to discuss their strategic plans. The Coulter Foundation is making a unique a unique contribution by recognizing the role of community health centers in Asian American and Pacific Islander communities. And Coulter is ready to make a 3-year commitment to many of our community health centers across the country. For AAPCHO's member centers, this represents an unprecedented opportunity to integrate and institutionalize voter registration as a regular service in your community health center. Someday, we hope to accomplish these visions. Gone will be the times and the days when policymakers say that Asian Americans and Pacific Islanders don't vote. And given the tremendous political standstill in our country, this effort represents a tremendous opportunity, a tremendous leadership opportunity to establish health centers as civic engagement leaders for this population considered the fastest growing in these United States. So before I close, I just wanted to make a couple of announcements to alert you. Besides the information that Mark is presenting to us today, I'm going to encourage you to go to the Community Health Vote website and download the voter registration toolkit and checklist. There are wonderful tools that are there that are available for you, and Mark will be highlighting some of those for you today. As part of this effort, your health center will be asked to develop plans that for integrating voter registration in your services, and that will be part of the effort that will be helping us determine the funding opportunities that will be available for your health center moving forward. We are planning another webinar after this to be announced soon, and that particular webinar will be focused for frontline workers or folks who are engaging community members with a major emphasis on what are some of the things that they can say and should not be saying as part of this voter engagement and civic engagement effort. So with that, I just wanted to just wrap it up and introduce you to Mark Weatherhorn, the primary speaker for this webinar. I'm very happy to be introducing you to Mark today. Mark has over 30 years of political organizing and advocacy leadership at the state and national levels. Mark established his firm, Mark Weatherhorn Consulting, to assist nonprofit organizations, trade associations, and businesses in creating an organizational culture, strategies, and structures needed to win meaningful public policy victories. And I also am very pleased to say that that I have worked for Mark for a number of years prior to this position. Mark had worked at the National Association of Community Health Centers for 15 years, where I got to know him as the National Advocacy Director for Advocacy and Grassroots Campaigns. So with that, I'm going to turn it over to Mark and wish you all a great webinar.
Thanks, Jeff. So Beverly, you want to pull up the presentation? Okay, and you can go ahead to the next slide. So thanks everybody for being on the webinar today. I always start my presentations about voter engagement with this. There is one rule you cannot violate. It's actually a law. You have to be nonpartisan, and whatever you do, you cannot support or oppose a candidate for public office either by implication or by action. So I'll talk a little bit more about that, but when we show you the Community Health Vote website, you will see that there's guidance on there about that, but also I'm always glad to help because this is the one thing that can get you in trouble. Any participation in a political activity as far as a campaign is concerned could cost your health center their 501c3 status. So not only you, but the folks at your health center that you have actually engaging in this effort really need to understand what that means. And as Jeff said, we'll be talking a little bit about that in a later webinar. So Beverly, next one. So I think it's important for everybody to understand, and certainly everybody at your health center, your board, all of your staff need to understand why we even want to do this. It's critically important because elections matter to the future of health centers and to our patients and to our communities. The populations who are least likely to vote are actually health center clients. You have a unique relationship with your patients and your community. They trust you. They come to you for their health care. Your influence on their willingness and interest in voting can't be overstated. And lastly, because we can make an impact. It's important to understand that, as you can see from these numbers on the screen, that a lot of people who wanted to vote simply didn't have their votes counted in the last couple of presidential elections, simply because they had registration problems. Folks don't know they need to update their registration if their name changes or if they move. They don't know in some states they need a photo ID. Some states they don't even know when the election is. It's really important to understand that this is not just about registering voters. It's about helping people actually cast their ballots. So next slide. So I just want to show you, we did this in 2012, and we studied the results from some of our work. And if you look at this chart, what you will see is that folks who were registered or contacted by their health center about voting in 2012 voted at significantly higher rates than those in their same demographic groups in their communities. So if you look at the Asian and other category, which is how they are listed on the voter file, you could see that if the health center registered you to vote or contacted you to remind you to vote, you were more likely to vote by about over 10% more likely than the rest of your colleagues in your community. That's a significant amount. If you think about the number of patients you see and the number of voters in your community, it gives you some idea of the impact you can have over time. Next slide. So what I'm going to talk a little bit about today is, as Jeff said, is how to integrate this into your ongoing activities at your health center. But it's important to understand what you're going to need to do to be successful. First of all, this has to be an organizational commitment. It can't be one or two people. It can't just be the CEO or the board chair or somebody on your staff. The organization as a whole has to understand that this is something that you want to offer as a service. Everybody has to understand why. Everybody has to understand that it's important, and everybody has to want to do it. In addition to that, you really need a few people at each health center and at each site who want to be individual champions. Someone who's going to be responsible, who really wants to make the program work. Third, you need a plan for implementation. When we're done here today, hopefully you'll be able to go back and sit down with other folks at your health centers and actually rough out an initial plan for how you would do this at your health center. Every health center is different. I'm going to give you ideas and best practices about how you can do this. You have to decide what will work at your health center given where you are in your community. And again, you need to know and remind everybody at your health center that by doing this, by engaging your patients, you are actually making a difference. What I would say to you, and what I always say, is we will be successful if we can make the demographics of the electorate actually look like the demographics of the community. I just saw, I know everybody's been looking at what's going on in Ferguson, Missouri. I think it's incredible to understand that Ferguson, Missouri is 65% African American. 65% of the population of that community are African American. Yet there's one African American on the city council, one African American on the school board. The mayor is white. The police chief is white. Most of the police force is white. The reason for that is because the African Americans and the people in that community simply have not exercised their power of the vote to make sure that the electorate in their community looks like the community. That's what we're trying to make happen in every community, certainly every Asian American Pacific Islander community, is you want the folks in your community to be empowered so that the electorate looks like the community. Next slide. So what do you need to do? You need to identify a group or individuals within your organization who are going to be responsible for the civic engagement program. I'm assuming that for many of you on the webinar today, that is you, right? But somebody has to be responsible. Somebody has to help put the plan together. Somebody has to be monitoring the plan. Somebody has to be reporting on the plan. You have to have somebody or a committee of people responsible for the activity. You need to start with making sure before you start telling your employees or front desk folks, your outreach and enrollment people, what you want them to do, they need to understand why you're asking them to do it. Right? It's really important that folks who are going to be on the front lines doing this work want to do it. Understand that they're making a difference. It's going to take some time. There are going to be some frustrations. There's going to be a lot going on for them in other ways. If they don't want to do this, they won't do it well, and you won't be successful. So don't overlook the need to make sure that your staff and your board all understand why this is important. Next. So you want to educate all your staff. If you don't register your patients, no one will, right? They're not likely to say yes to people trying to register them at a mall or knocking on their door. You have a unique opportunity to register most of your patients. Okay, there are studies that show that voting makes you healthier. People who vote are simply healthier. People who are engaged are healthier. It is one of the social determinants of health, right? You want to talk to folks about why it's important to register to vote, right? Not just for them, but for their families, their friends, and their communities. Even if somebody comes in who themselves can't vote, they may have somebody in their family who can register, somebody they know who needs to register or update their registration. Don't assume just because somebody themselves can't vote that they can't also help you register other people. Right? Once you register to vote, it's public information. The voter files are public. You can actually find out if your family members are registered. You can find out if everyone at your health center is registered if you want to do that. It's not required, but you can. Next slide. So what's the #1 best practice for you at your health center? What's the most important thing to consider? You want to view voter registration as another service your health center provides. You want to integrate it into your health center's ongoing activities. If you think of it this way, it makes it a lot easier. It's better than trying to do it sporadically just before an election. It's better than trying to do it as an afterthought. It's better than just doing it at events. You want it to be another service you provide all your patients. Just like anybody coming into a health center gets health care no matter their ability to pay. You want people to come into your health center. Everybody who comes in should have the opportunity to register to vote or update their registration no matter who they are. Next slide. So where's the best place to do it in your health center? When you've been thinking about a plan, where are the places in your health center that make the most sense to ask people if they want to register to vote or to help them register to vote? Okay. It depends on your health center. I don't know what your health center looks like or how many sites you have, but that's why I'm only giving you how you can do it. I am not telling you how to do it at your health center. Okay? You can do it during intake when people check in. You can do it while they're sitting in the waiting room waiting for their appointments. You can do it, this is after coverage enrollment. I think you want to do it during coverage enrollment when they're being enrolled either in the ACA or Medicaid. You can do it when they're checking out. You can do it at events, and you can do it at any or all of those above places. So think about your health center, think about where it might make sense to do it. You may need to start in one place and take it to others, but those are generally the best places to think about doing voter engagement. Next step, next slide. So the basic best practices are these. One-on-one interactions always work best. Rather than standing up in front of a room of people and saying, who wants to register to vote, or trying to do it by just handing out pieces of paper to folks in the waiting room, it's always best to have somebody ask the question when they're engaged with another person. So when they're doing coverage enrollment for Medicaid or the exchanges, when they're sitting with somebody doing their sliding fee determination, when they're at the pharmacy window getting a prescription filled. Okay. And you can use your outreach workers or others if you want as kind of go-to assisters, people that folks can be directed to for help registering to vote. Somebody has to ask. Leaving registration forms or information out on a table in a waiting room or attached to a poster simply doesn't work. Somebody has to say to folks, would you like to register to vote or update your registration? You can do it at check-in, you can do it at the waiting room, you can do it at events. You just can't think that by passively leaving information out that you're going to be successful. Next. How you ask matters. I will tell you that this is one of the most important elements to being successful. And I think this is especially true in an Asian American or Pacific Islander community where our culture has a huge impact on how people interact. You want to spend a lot of time training your staff on how to ask the question. You want to frame it as just another service that your health center provides. If you do it that way, you're much more likely to be successful and just have people say, would you like to register to vote? Do you want to update your registration? Voting's important. Can I help you? You want to make sure that they think of it as just another service you're there to help them with. Visibility matters. If you don't have signs around your health center, if you don't have buttons on your staff, people are going to walk into the health center and they're going to be surprised when somebody says to them, would you like to register to vote? They're not going to think about it. They're going to wonder why you're asking. So you want to think about how you can make voter registration visible in your health center. Okay? Enthusiasm matters. Again, if somebody just says, you want to register to vote, that's not likely to get yes for an answer. If somebody is really enthusiastic about how important voting and registering to vote is when they ask the question, they're much more likely to get yes for an answer. And that's what we're trying to get to, is yes for an answer. Next. One of the health centers that we work with, we gave them this quote, the script on the Community Health Vote website. They actually printed this up on cards and gave this to all their folks who were going to be interacting with patients to register them to vote, so they have it right in front of them. So they don't have to guess or try to remember what the question is. This is in English and in Spanish. You would want it in English and whatever languages that you think are appropriate for your health center, but this is really the way you want to ask the question. Another important service we offer is helping you register or update your voter registration. I can help you quickly register to vote or update your registration right now. It'll only take a couple of minutes. That's a lot different from saying to somebody, would you like to register to vote? And spending time making your staff comfortable with how they ask this question and how they respond when people respond to them is really important. Next. So if you're going to do this at intake, right, when folks are checking in, what I would suggest is that you have a form on every clipboard for every patient who comes in, which basically, I'll show you one in just a minute, so they can determine whether they want to register to vote or not. They can either register to vote or get reminders. But again, every patient should get something asking if they're registered to vote or want to register to vote. If they say they want to register or update their registration, again, your health center, you might have your folks at your front desk do this, but I don't recommend it. I recommend having a few people at your health center who are the designated assisters. So when somebody tells the front desk that they want help registering to vote, you can send them to somebody who can help them so you don't back up your front desk registering people to vote. You don't send people to sit back down with the voter registration form. They may need help with it. So you want to try to do this in a way that asks them at the front desk but doesn't clog up your front desk helping people. Okay. And again, if people say they're registered to vote already, which a lot of health center patients will say, we still want them to fill out a pledge to vote card or an information card so that we can follow up with them to give them information and reminders about voting. So you'll want to have something to give to people when they say they're already registered. And again, I'll show you examples of these in just a second. Next slide. Again, the front desk, dental front desk, your pharmacy staff can make the ask. You want to be able, again, to send them to somebody, your outreach and enrollment coordinator, if you have a WIC program, your WIC coordinator, or whoever you designated to be assisters in helping with registration. You want everybody who's asking patients to know to whom they should send these folks for help. In some cases, you might have a way to call them to the front desk so they can help folks, but you just want to make sure that everybody knows who's around to help folks register to vote. Next slide. So this is what I meant when I said a follow-up sheet. And basically, we develop these for community health votes. You can develop your own, but basically, this simply says to people, we think your vote is important. It can make a difference. If you want reminders or about the election dates or voting locations, fill out this form. Tell us how you'd like to be communicated with. If you want to register to vote, they can check this. They should turn it back into the front desk. The front desk sees that it says they want help registering to vote. They can again direct them to an assister. But again, we want this information so that we can follow up with them about the election. They also have an opportunity to sign up as an advocate to get more information about working for their health center. You'll see that at the bottom. But just as a reminder, it's not just about registering them to vote. It's about registering them, but also engaging them so we can help them vote and make sure they know how to get their ballot actually cast. Next slide. And this is a pledge to vote card. This is when somebody says they're registered to vote. You could say, that's great. Would you like reminders or more information? We'd love to have you pledge to vote on November the 4th. Every vote counts. Next slide. You can fill this out. You can fill this out, and we will send it back to you as a reminder before the election. And again, there's two purposes for this. One is we will collect these cards. You will collect these cards. We will enter them in a database. We will actually make sure these folks are registered to vote, and if they're not, we can go back to them and let them know that for some reason they are not registered and give them the chance to register on their own or to come back to the health center and register. Next slide. So when I said making it visible, this is what I meant. These signs you'll see were actually developed by a health center in Virginia. I had nothing to do with them. They did this on their own. The best place in a health center to put a sign that folks will read is the back of the exam room door. While people are sitting there waiting for the doctor or the nurse practitioner or physician's assistant to come in, they have nothing to do, nothing to read. They're not supposed to have their cell phone on. They see this on the back of the door, and somebody comes in, or they see it and they go out and ask at checkout about registering to vote. That's really what you want, right? Putting a sign where nobody will see it is not really of much use. You want them in as many places as you can. Next. This is a sign that they put on a tabletop in the lobby. They had folks in the lobby assisting with registration. So they put this sign out there in the lobby of the waiting room, so when folks came in, they saw this and were able to ask if they needed help. Next. And these are just signs, as you can see, they put them around all around the health center. Just letting folks know they can register to vote at the health center, and that they could ask about voting there. So again, it's not so important that your posters be fancy or beautiful. What they need to be is visible. They need to make people comfortable with the fact they can register to vote at your health center. Next. So if you're going to register people in a waiting room, a lot of people think of doing this in the waiting room as having folks wandering around the waiting room asking people if they want to register to vote. That is the wrong way to do it. You want to have volunteers or staff at a table with signage in the waiting room. You want them to be able to engage the patients as they come by, asking them if they'd like to register to vote or update their registration. You'd like them to be there so if somebody says they want to register to vote at the front desk, they know who to send them to. But you don't want people wandering around the waiting room engaging patients while they're sitting there. It puts patients off, it scares some of them, and it hasn't proven to be very effective. And again, you can even have stickers that you can give to people who register, so as they're sitting in a waiting room or walking around, people will know that they've registered to vote and that they can register to vote at the health center too. Next. So we anticipated that during enrollment in the ACA marketplaces or in Medicaid, there would be the option to register to vote. And in fact, in the marketplace form, as you fill it out online, there is a question, would you like to register to vote? Unfortunately, it comes at the end of the application process after people have spent 2.5, 3 hours filling out a form to find out if they're eligible for coverage. What we found is that, and this comes directly from O&E people who've done it, not many people are willing to even spend another 2 minutes registering to vote, filling out another form after they've just spent 2 or 3 hours filling out an application for health insurance coverage. So the really best way to do this is to do it before you begin the enrollment process. If someone comes in and sits down, basically you say to them, you know, before we get started, one of the other services we provide at our health center that we think is really important is to offer our patients the opportunity to register, vote, and update their registration. We can take care of that in 2 minutes and get on with your application for coverage. Again, you're much more likely to be successful if you do it up front and you kind of ask the question in that way than if you wait until it shows up in the enrollment process. Now, we have, and I haven't talked to Jeff about this, but AAPCHO could have its own online voter registration tool so that you can actually register people online, print out the form, and turn it in for them. Beverly, do you want to just show people the website? Can you do that really quickly? So this is the Community Health Vote website. It's communityhealthvote.net. It has a lot of material on there for each state under state registration materials. It's got information about registering voters and the rules and restrictions about registering voters in your state. There are downloadable forms that our partners of the Fair Elections Legal Network have put together. It's got questions and answers about Community Health Vote. It's got the toolkit that Jeff mentioned. If you click on the toolkit page there, Beverly, and then scroll down. It's got all these documents. You can download it as a single document or any one of these scripts for making the ask, the checklist of recommended practices that I'm going over, a whole bunch of information that you can use. And again, I think Jeff's right. You should download this. It's got legal questions and answers, so you kind of understand the legal parameters for doing this at your health center, and a bunch of other stuff. So that's all on that page. And then go back up to the top. Click on the vote, register to vote. Yeah, we actually work with Rock to Vote to develop an online voter registration tool. We don't have time to go through it right now, but you can each go to this site, go on here, and walk through the process. You're not actually registering or re-registering to vote until you get to the end and print out the voter registration form and mail it in. The only states for which that is different are California and Nevada. Basically, in those 3 states, and I know there are folks on the phone, I think, from California and Nevada, in those 3 states, this actually connects to the state's voter registration site, so that if you have the appropriate ID, you don't even have to print anything out. You will start at this site. It will take you to the state's voter registration site, and you'll be able to register or help patients register to vote. The reason we encourage you to do this, to use this site, is because the information that gets put in at the beginning allows us to, again, that gives us the contact information for folks so that we can follow up with them with reminders and other information. So what I would say is explore the Community Health Vote website. If there's material that's missing, let us know. If you have questions, you can let me know. My contact information is at the end. But there's an awful lot of material and information up here for you and anybody at your health center that's going to be doing voter registration. So Beverly, back to the presentation. So again, I think it's certainly quicker if you use the online voter registration tool whenever you can, but if not, you can certainly use the paper forms in your state, except in Washington State, I think it's all online. So next slide. Now, a lot of folks want to work with partners to have them come into their health center and help with voter registration. That's perfectly fine. It's hard to do on an ongoing basis, but when you think there's a lot of interest, or you're going to have a lot of activity, whether it's at your waiting room or at your events, you want to make sure you find a trusted nonpartisan partner. Just because somebody tells you they're a 501c3 does not mean they're nonpartisan. They may have the perception of partisanship depending on the states, depending on what they do. So I would just say try to work with folks you know or that you find out about, not just anybody that says they want to work with you. You don't need partners or people in your waiting room all the time. You know when the busiest times in your waiting room are, so you want to make sure that you have a schedule set up so that you've got folks in the waiting room to register voters at the busiest times. You want to make sure there's a schedule. You want to make sure that these folks are well trained, that they understand how to work in a health center, and health center, how health centers are different from doing voter registration in other places. And remember, they may be volunteers. They may be volunteers with another organization, but they're assisting you with your voter registration efforts, and you're ultimately responsible. They need to understand that. You want to make sure that they're culturally competent for your community. You don't want people coming in who are not interact well with your patients, right? The goal is to get people to say yes to registering to vote, to capture their information, and to do it in the right way. Some partners are better than this than others. You just want to make sure that you're working with the right folks. Next. Events. You all have health fairs and other activities throughout the year. You should always have a voter registration table or booth set up at any of those events that you do. The one event I want to point out to everybody that this year you really should plan to participate in is National Voter Registration Day. It's September the 23rd. It's been recognized by the National Association of Secretary of States. It's going to be a really big deal. It's kind of like a holiday for voting. You can get more information and free materials on National Voter Registration Day at the website that's listed on the presentation. And it's a good way to get started. If you haven't done anything before, it's a really good event to try to put together focused on voter registration. And then you can also, your health center can also do voter registration at other community events that you're participating in. It again depends on staffing and the kind of event. Next slide. So at events, again, this is pretty much the same thing that works at your health center. You want the table to be visible, not stuck over in a corner. You want people to have to walk past it. You want the right staff and volunteers there. Somebody needs to put their phone on mute. There's feedback. Sorry. Again, everybody at the event, no matter what you're doing, where you're doing your checkups or your screenings, you want to ask folks about registering to vote and refer them to the voter registration table. And then at an event especially, somebody's got to be responsible for collecting and securing the completed forms. And again, you want to give out stickers. I'll mention this here, but it applies everywhere, is you never want to have somebody fill out a voter registration form and leave with it. You always want them to fill it out, read it, sign it, and hand it in to whoever is assisting them so that you can turn the registration forms in. If you let folks leave with a blank form or with a form that they haven't signed saying they're going to mail it in, it's not likely to get mailed in. They get lost. The old "my dog ate my voter registration form" comes into play. So you really want to have a system for collecting the forms at your health center, at every site, and certainly at any events where you do it. Next. Again, so just to sum up, the general best practices: treat voter registration as just another service. Ask them more than once. Remember, the average health center patient comes into a health center a little over 3 times a year. They may say no the first time, second time, they may say yes the third time. So always ask more than once. Okay. You want to make sure that wherever you're going to be doing this, you touch base with your county registrar. Make sure that if there are any local requirements that they have in place, you know what they are. Your registrar can be an enormous help. They may send people to your health center to help you register people to vote. They may be willing to bring a voting machine into your health center to show people how to vote so that folks who've never voted before know what to do. So you just want to make sure that they know what you're doing and can help you in any way that they can. Okay. Again, you got to have somebody at each site be a coordinator for your activities. If you have multiple sites, thinking that one person from one site can routinely go around to all the other sites and provide the assistance and oversight and collect the forms, it just doesn't work. You know, you still want to do that, but don't think of that as the only oversight at each site where you're doing this work. Use the pledge to vote cards or the contact cards to contact people, to get people's contact information. You want to especially use the pledge to vote cards for people who say they're already registered. As I said before, you want a system for collecting and completing submitted forms on time. You need to know what the deadline is in your state. In some states, you have 10 days to turn in completed registration forms. In some states, it's less. In any circumstances, you have to have all completed forms turned in by the voter registration deadline before the election, which is different for each state. All of that information is in the state voter registration tool forms on the Community Health Vote website for each state. But you need to make sure, you know, a good practice is make sure that somebody collects all the forms. They're centrally collected and turned in to the registrar. I don't recommend mailing them. I recommend having somebody take them to the registrar's office, unless you really trust the U.S. Postal Service. Generally once a week on Friday afternoons, somebody can take an hour or half an hour and take them to the registrar and turn the forms in. But you need to have a plan however you choose to do it. Okay. The other thing you can do is add a registered to vote field to your EMR, EHR database so that when somebody says they're registered to vote or when somebody gets registered to vote, you can note that in their patient record so the next time they come in, they can be thanked for registering to vote, or you don't have to ask them if they want to register to vote again. You already know it. Next. have realistic goals and expectations. I put this in here because what I will tell you is that a lot of people think, oh my God, this is going to be a lot of work. My staff is going to be overwhelmed. How are we going to do this? I wish I could tell you that was true. What I will tell you is this, is that at any given health center site, if you register or update registrations for 5 people in a day, you will have done really well. If health center patients were easy to register to vote, they would already be registered, right? So don't think that when you begin to integrate this into your activity that you or your staff or your health center are going to be overwhelmed. Maybe over time, maybe once people know that they can do this at your health center, it might get busier, but to start out with, have reasonable expectations and reasonable goals for what you can accomplish. You want to know the law? Mainly you want to make sure that your staff and volunteers know the laws that govern voter registration in your state, and you want to make sure that they are completely and absolutely nonpartisan, and you need to keep reminding them and do quality control by observing them as they go through this process to make sure nobody is doing anything that would violate the law. Your staff is the most important thing, right? If they do this well, they will be extraordinarily successful. If they do it poorly, no matter what kind of materials you have, no kind of plan you have, you're just not going to be successful in a really effective voter engagement effort. And then help us capture the data for voter education and GOTV activities. The reason we want to capture this data, again, is so we can help make sure people vote, but also so we can give them the opportunity to stay connected after the election. It's great to register them to vote, but if we don't know who they are, if we haven't given the option to get reminders, or if we're not able to get back in touch with them in case there's a problem with their registration, we've really only done half the job. And then lastly, ask us at Community Health Vote. You can ask me. There are others for help. That's what we're here for. I can assure you that as time goes on, hopefully we'll have the opportunity and the resources to come to your health center and help with trainings with your staff, help you assess your plan. But don't think that it's a problem for getting in touch with me or anybody else at Community Health Vote or at AAPCHO for that matter if you think you need help. Next. Again, I just want to remind you, you've got to make sure that you get the forms turned in. You don't want them left laying around. You don't want them hidden under a filing cabinet. You want to make sure they get turned in. And you want to make sure that you routinely send us the contact information or the copied forms where you can do that so that we can follow up with folks. Next. So I repeat what I said at the very beginning. You need an organizational commitment, and hopefully after I've gone through this, you understand why your board, your managers, your leadership, all your staff need to understand why you're doing this. It does take everybody's effort. You do want people who are really committed to it, who want to make it work. You need a plan for all the things I've gone through, and you need to know that you're making a difference. Those are the elements of success. There are a lot of moving parts. This is actually not complicated. You just have to plan to do it and to do it right. Next. And this is my contact information. That's my email address and my phone number. You can feel free to contact me directly if you have questions. I don't know, Beverly, are there questions from folks at this point in the, for the presentation?
None were submitted during the presentation, but if you have any questions, just a reminder that you can submit them through your questions field, or you can also participate by clicking the raise hand button on your control panel on your screen. Mark, I know you had to leave in a few minutes. Did you want to let folks know? And Jeff is also here.
I have a preliminary question for you, Mark. What would you say to health centers who have a concern about HIPAA? What should they be conscientious about when implementing this program?
Yeah, the only element of HIPAA that comes into play is doing anything with any of the information that you collect that would somehow indicate that the person whose information you have is a patient of the health center. We don't do anything in the database that's made public about the nature of the patient or their relationship to your health center. We do know we track how many folks are sent in from health centers, from your health center. We will have their names in the database, but basically that is private. It's not made public. It's done in a way so that there isn't a HIPAA issue. Again, you can't use your patient information database. In order to communicate with folks, you need to have their information. They need to give you their permission to communicate with them, or if they register to vote, remember that once they register to vote, their voter registration and the information that's on it becomes public because it goes into the database. So there isn't really a HIPAA issue unless you do something like write the name of your health center on the voter registration form when you turn it in, or write the name of your health center on something that's going to be made public, write the name of the health center on something that you mail to the patient that indicates they're a patient of the health center. Especially if you're also doing this at events, out in public, or for people who may come into the health center who aren't patients, then simply by keeping all the information together, there is no indication of who's a patient of a health center and who isn't. So that's what I would say, Jeff, is, again, that there's nothing inherent in doing this work that in any way violates the HIPAA laws for folks.
Thank you, Mark. One question did come through from Christina, and Christina, I can also unmute you. She's asking, can outreach materials and forms shown during the webinar being shared with CHC to use?
It can be shared with what?
So can it be shared, the forms that you had shared during the webinar, can they use these at CHCs?
Absolutely.
Or Christina, you're also unmuted if you wanted to add to your question.
Yeah, any of the forms. Yeah, sorry, go ahead.
Oh, go ahead, Mark.
Yeah, any of the forms and the things we have available on the Community Health Vote website, or any of the things I showed on here, are certainly available. One of the things I would say for you guys is obviously in your communities, you're going to want to get some of this information translated into the languages that work at your health centers. We have these in English and in Spanish. I don't think that fits y'all's needs, but the forms, the language, any of the information that we have is certainly available for y'all to use any way you want. Anything you download off the Community Health Vote website is certainly available for you to use. I'd just like you to let me know if you're planning on using it for something really for my own purposes rather than for anything else. So does that answer the question?
I think so, Mark. Thank you. Christina.
Okay.
Thanks, Christina.
Are there any other questions for Mark?
I know I went through a lot of stuff today, and my goal was not to kind of do a full bore training for you. My goal was to really lay out for you kind of the elements that we know are necessary to consider in doing this at your health center, really for the purposes of helping you think through a plan that would work at your health center and the kind of things you need to do. We're around to help you if you have questions about it, but essentially there's a lot more kind of training and other activities that need to go on for the folks who are actually going to be doing this work, but really just wanted to make sure you had an overview of the best practices that we have learned over really 4 to 6 years of doing this at various health centers, and I'm sure there'll be more. And hopefully we'll get some feedback from you about what you think and what you need that we haven't provided.
All right. Thank you very much again, Mark. So as part of my closing remarks, I just wanted to remind folks, as Mark noted, that we are going to be planning another webinar, particularly a webinar that will be more focused on frontline staff that will be engaging our community folks in this community engagement or voter engagement effort, and we'll be sending dates out soon. Additionally, I just wanted to emphasize again to those of you that will be participating in the AAPCHO Culture Civic Engagement Initiative, September 23rd is our first major milestone. I know it's just around the corner, but it's going to be very easy for you and your health center to register as a partner for National Voter Registration Day. There will be more communications coming from AAPCHO and some of our other civic engagement partners around this effort. But please, if you have not already registered your health center as a partner on National Voter Registration Day, go to that website, and log on and register your organizations and promote activities that your health center is involved in on the September 23rd day. And as also noted in the beginning and throughout this webinar, the purpose of this webinar was really to start helping you in the development of civic engagement plans for your health center. These plans that you will be developing will be part of the application process for AAPCHO, and there'll be more information about the applications and grant programs that are going to be available to support civic engagement efforts in the weeks to come. And so I again want to thank you for joining us for this preliminary call. Look out for further announcements about upcoming trainings and webinars that will be going on, and more information about the civic engagement initiative that AAPCHO is involved in. So with that, I want to thank you all for participating. I want to thank Mark and Beverly for their leadership in conducting this webinar, and I hope you all a great week.
Thank you, everyone. And
Thanks, Jeff.
Thank you, Mark and Jeff. Thank you, Mark. Thanks for joining everybody. As Jeff mentioned, there'll be a follow-up email. I'll include a link to all of this information and the slides, and also a post-webinar survey if you could submit some feedback to let us know to make future trainings better. Again, thanks, everyone. Have a great rest of your day.
Thank you.